I might just give one more minute just to have people able to join. I know sometimes it can be a little bit tricky, so we might just give one more minute, I think. Okay, should we make a start? All speakers ready? So welcome everybody to today's seminar. This is the last one of 2022. So I hope you're all well as we roll our way to Christmas. We have today three fabulous speakers on the topic of mental health in schools. It's such an important topic that's more and more pertinent. So I'm delighted to be able to introduce them. We have, first of all, Professor Jessica Deighton, who is Professor in Child Mental Health and Wellbeing at UCL. She's Director of the Applied Research and Evaluation at the Anna Freud National Centre for Children and Families and Director of the Evidence-Based Practice Unit. Her expertise focus is on the evaluation of interventions and programmes to support mental health and wellbeing in children, as well as factors that promote resilience in children and young people, and the interplay between mental health and educational outcomes. She also co-leads the early intervention theme for the Department of Health's Child Policy Research Unit. After Jess, we will have Dr. Laura Crane, who is Associate Professor at IOE, UCL's Faculty of Education and Society, where she's Interim Director of the Centre for Research in Autism and Education. Central to all of Laura's research is a commitment to ensuring that research makes a genuine difference to the lives of autistic people and their allies. She's a champion of participatory approaches, which I hope that we'll come to today. And she's won several awards for her work, including a UCL Provost Prize for Public Engagement and the Charity Autistic's inaugural Community Engagement Award. And then following Jess and Laura's talks, we'll have a response from Jaime Smith, who is the Director of Mental Health and Wellbeing in Schools at the Anna Freud National Centre for Children and Families. Jaime's background is in education and the NSPCC, as I understand, with many years training experience in inner city London secondary schools. Since joining the Anna Freud Centre, Jaime has led on all schools work at the centre, including building the Schools in Mind network, a free network for school staff and allied professionals, which shares academic and clinical expertise regarding the wellbeing and mental health issues that affect schools. So I'm really excited to introduce these three speakers. Just to say the speakers will, I'm just going to let the speakers talk in the order that I have introduced them. So I won't interrupt the sort of flow. If you could save your questions at the end until the end, that would be great. As was said at the beginning of this, do put your questions either in the chat or direct message me, or save them and ask them in person after the speakers have finished. So thank you all for being here, and Jess, I'll pass on to you. Thanks very much.
Thanks so much, Bonnie. Really nice to be with you all. Nice to do something so near the end of term. My main aim for this talk is not to cough at any of you while I'm speaking, which is quite possible. So if I do start coughing, you just have to excuse me while I just disappear off screen to get some water or something, but hopefully we'll be okay. So yeah, I want to talk around a few topics which primarily focus on how we can best support children and people's mental health in the school context, but I'm just going to zoom out a little bit for the beginning of that. Just much of this I'm sure will be a bit familiar, but I think it's just helpful to give the context of the last couple of decades to kind of show why this feels like a really important time, I suppose, to focus on schools particularly. So I'll start with that and then talk a bit about, you know, what challenges do we have in front of us at this moment, why schools are a good place to start, really, particularly with prevention, and just a reminder, really, that schools are obviously just one piece of a very big system that all needs to be involved in those kinds of solutions. So then, taking the sort of brief history of children's mental health. I suppose I'm just trying to build a very brief picture here of where we've been in the last 20 years in terms of our understanding of at least the extent of need in terms of mental health. So about 20 years ago, we had a sort of prevalence study, and we cited this for a long time: 1 in 10 children and young people experiencing mental health problems. I still see that in reports now, even quite recent ones. But that was a sort of general understanding of broadly how many young people might be needing support. And we had to wait quite a while really to get any kind of advance on that picture of what the level of need was. So in 2017, there was another sort of really good wide-reaching study that told us that that figure had increased slightly to 1 in 8 children and young people experiencing problems. And that, I think, prompted some anxiety really generally about what's happening with children's mental health. And there was lots of sort of reflections on what does that mean, what's been happening in the lives of young people that sort of accounts for this increase. Lots of sort of worry around social media, which I think is legitimate, but also when we talk to young people, they actually talk about a much more wide-ranging set of challenges that they feel that they're living with. And when we look at that period between sort of the early 2000s and sort of 2017, lots of things changed in that time. So yes, social media was one of those things, but also we had even before this recent cost of living crisis, we had lots of austerity kind of measures being put in place, more children experiencing poverty, and we also had quite a lot of changes to the school context itself. So much more kind of sense from young people that there is a real high stakes testing pressure in schools, particularly in the UK, which seems more pointed here than it does in other countries. And also a kind of erosion of free time for children and young people as well. So lots of sort of eroding of break times in schools, which some great studies from IOE pinpointed, but also a sense that young people are often spending time outside of school doing quite structured activities that don't give them much downtime. So all of those things make life feel quite busy and can be quite stressful sometimes. And those are just a few examples, of course. What we also got from that particular study was a sense of where young people seek help from or where they get help from. So although it seems that only around 1 in 4 of those experiencing quite high levels of problems were getting sort of specialist support, so CAMS, for example, actually what young people were saying about where they seek help is that about half of them were saying that they would actually seek help from teachers in school because they're the people they see and know every day and that they trust. Around that time as well, we got an increasing recognition from the government that school might be an important context for mental health support, and we had a green paper that was all had a number of dimensions to it, but 2 key prongs were about increasing capacity to support children and young people within schools. So training up senior mental health leads within schools and creating these mental health support teams that provide a sort of bridge really between those specialist services and the school context. And obviously over the recent years, that's been, really gaining kind of momentum in lots of different areas across the country. And then, of course, we had the pandemic. So we had quite a bit of extra data collection that went along with that, trying to understand what the impact of the pandemic was on young people. And we did see another increase in the prevalence of mental health problems. And that was the case in 2020 and 2021. It stayed quite sort of stubbornly at 1 in 6 children and young people experiencing difficulties. And it looks like we just had some data release again, was it last week or the week before? So very recent, which again suggests those problems are staying quite stubbornly high, and particularly in sort of later adolescence, they really appear to sort of really have bedded in. So yes, we've got the pandemic adding to that picture, but of course we've got the recent cost of living crisis again on top of that. And we're also getting a sense from young people of a lot of sort of climate related anxiety as well. So lots of sort of feelings of the world feeling like a slightly scary and slightly unsafe space for them as well. So sort of familiar backdrop, but just to give a bit of context. So what are we saying the challenge is, I suppose? I mean, I think it's clear from those figures that the need is it's not just outstripping, but it's also outpacing the resources. It's like trying to lay down track before a train comes. We're trying to embed these things and recognizing what good prevention might look like. But at the same time, we've got this, what feels like kind of looming need, which keeps increasing. So we need to really think about how we address that, and it can't just be, you know, adding incremental amounts of the same on top. We need to think a bit sort of differently. And we can see by the increase in referrals to CAMHS, you know, that we can't just keep adding a bit onto CAMHS, because that's not really going to meet the need. So we need to diversify how we think about mental health support, and that means intervening earlier in the course of problems, so that we don't, you know, we're not getting to this sort of extreme end of difficulties and then having to sort of throw a lot of resource at that. But also we need to broaden our conceptualization of who our mental health workforce are. So that's not just those with specialist training, but actually anyone who has contact with young people, anyone who they trust and feel they can go to. And as we've seen, teachers are a big part of that, and other school staff, in fact. So that's the problem. So why might schools be part of the solution? Well, as for a lot of prevention work, we look at things like vaccinations. Often they happen in schools, but really schools is a really helpful universal or almost universal access point for young people. So it's a really helpful place to give those sort of public health messages, to embed some social emotional skills, and to embed some of that early intervention work, and also recognizing where need might be sort of escalating for some individuals. We know from the study I just mentioned that children and young people will quite often turn to adults in school if they need support, because they already have that existing relationship. So it makes sense to upskill those people to have those conversations. But also we know that, you know, positive wellbeing in childhood, if we get that right in the school age, and then that does sort of bode well for later life in terms of, you know, young people's ability to function in later life. And if school is about anything, really, it should be about, you know, how can we make our young people function later in life, be active contributors to society, and so on. And finally, because we've got sort of fairly good evidence that intervention in schools improves mental health, and I've qualified that with fairly for a couple of reasons. So there've been a few sort of evidence syntheses in recent years that have tried to pull together the evidence base out there for sort of universal kind of level interventions to support mental health and well-being. And one of those we carried out for Public Health England a couple of years ago. And sure enough, the evidence for that sort of universal, possibly community or school-based work mostly was from schools. So we found that the most compelling evidence came from sort of school-based approaches. And there seemed to be a small number of programs that had been evaluated really well repeatedly that demonstrated sort of fairly good effectiveness. And there were a few common elements to those. They weren't all common, but some that came up again and again were, yes, they were provided in schools. They tended to be group-based, often, you know, just within the child's class. They tended to be sort of discrete sessions, so, you know, a lesson or something, and delivered over a series of weeks. And generally by professionals or those who'd been trained quite extensively in the approach. They often were skills-based, so social emotional skills quite often. A lot of them were around cognitive behavioural principles, and the last one seems obvious, but they had made significant effort to make it engaging. So it wasn't just about, you know, telling young people about mental health. It was about engaging them in discussions and role plays and activities that made that sort of a more interactive process. Another recent review has highlighted similar things really, but also particularly highlighted social emotional learning as being particularly effective, and again, cognitive behavioural based principles. And they also said that some of the bullying interventions that have been tested showed particular promise for mental health outcomes as well. But there are definitely gaps in the evidence. So while there's evidence, and quite strong evidence, for a few approaches, actually there's a whole load of practice out there that's not well evaluated, it's not well tested, and it's not well understood. So there's a lot that we don't know. There's a lot of poor quality evidence out there as well. But a few things we do know, but we still need to understand more about. We know that implementation matters. So if something's implemented poorly, it's much less likely to have, you know, effective impact on children and young people. We know that studies can show short-term effects of interventions, but actually not much is known about whether that's sustained in the long term. And also, there's generally a lack of consideration or sort of early planning that goes into thinking about the specific context to which these interventions are going in. So does it fit the school environment? Can it be embedded in the curriculum? How long will it stick around if we put it in there? Those kinds of questions. So those are the things we're still sort of left wondering about. So really, we need a more substantial evidence base about all these practices. We need much more kind of systematic evaluation of all these approaches. We need a greater understanding of implementation, and we need better understanding of how these interventions sit in the wider system. And we also need to do a better job at getting the evidence out there into the world. So what we know from some of our work, this is dating back a while, is that when we talk to schools about what they do, they'll often talk about borrowing practice locally. It's not very often that they will use something, that they will completely make something up, but it's not as common as we'd perhaps like that they will take something that's been found in the sort of national or international evidence base to be effective. That's not their first port of call necessarily. They will often talk to local schools and say, oh, what worked for you? Oh, we'll borrow some of that. That sounds great. Which makes sense in terms of understanding a local context, but it does mean there's lots of things out there being used that haven't really been robustly tested. So even if we do know what works, it's not often what gets rolled out. And then often when things are embedded within schools, that they have a lot of adaptation that happens. And sometimes that's just because, I don't know, I can never stick to a cooking recipe, for example. I always have to add my own flavour. I think teachers are a bit like that too. They're creative people, but also because often that lack of consideration of the context it's going into means it doesn't quite fit, and that schools often will know their students better and know what will work more, so they tend to do some adaptation, but we don't actually know what that means in terms of effectiveness. You know, what's the really important active ingredients not to change, and what are the things that it's okay to adapt? So those questions are all still there. So one example of the way we're trying to address some of these issues is with quite a large-scale project that we've been working on for longer than we intended to, thanks to COVID interruptions. But this is funded by the Department for Education. And it was motivated, I think, by recognising two things. One, that there are effective interventions that have been tried and tested in different countries, but we don't know if they work in a UK context. Two, there's lots of practices in schools which involve sort of quite light touch approaches that schools will adopt, but we don't really know anything about whether those very light touch approaches actually are worth doing or not. So it's helpful to know whether the things that schools sort of adopt instinctively are particularly helpful. So we had two trials that kind of tried to address some of those sort of queries, I suppose. And the first is very much taking interventions that have been tried and tested before. And the second is much more about trying to sort of systematize a bit the kinds of things that schools do and understand them better. So in the first trial, we're testing two interventions, one that was developed in Sweden, one in Canada, that are very much about mental health literacy. They are those kinds of interventions that I mentioned, so discrete number of sessions that are delivered over a series of weeks. And we're comparing them to what schools would do usually. In the second trial, we're trying a couple of interventions which are very much kind of light touch, drip fed principles of relaxation or mindfulness. And then another intervention, which is called Strategies for Safety and Wellbeing, which was based on something that schools were doing, which looked a bit more like safeguarding, actually, when we looked at it. But Jaime's team at the Anna Freud Centre developed something that was more mental health focused in that kind of space for us to sort of understand that a bit more, how that might work in primary and secondary schools. And again, we compared each of those interventions to usual practice. So at the moment, we're still rolling those out. We have managed to embed a longer term follow-up, which is fantastic, but it does mean we're going to be waiting for the findings for quite some time. But there's a couple of things we have learned along the way. So when we first looked at some of these interventions that have been tried and tested elsewhere, we definitely found they did not fit a UK context. So there was a lot of kind of negotiation with those developers about how much of this is really crucially the intervention, how much could we adapt, and working with schools to kind of co-produce some of those changes. We definitely learned with the hundreds of schools we've now had involved in this trial, well over 400, that the context varies hugely school to school. And because of that, adaptation definitely happens. And even as much adaptation and flexibility as we've tried to allow, even more happens when you actually just put it out there into the world. And partly as a result of that, but also just because of the complexity of schools, sustainability of those interventions, so whether they continued with them after the research gaze disappeared elsewhere, has been massively variable. And that's been a source of real interest to us about what, you know, how can you get the most value for money out of some of these things that we hope will be effective? Well, the best is if we can get it to sustain, but I don't think we really know the answers to how that works yet. And the final one is kind of the point I'm going to go on to, which is these interventions don't tend to work well in a vacuum. And that's not something I can definitively say from this trial, but we can definitely see it from the previous literature, that when you embed interventions in schools, they really need to plug into an environment that's receptive to mental health as a sort of topic of conversation, well-being as a focus of the work that they do. So I'm just going to say a bit more about that. So there is something about fitting it to the school context, but there's also something about not constantly feeling like schools are the solution for everything. So this absolutely has to be part of a wider ecosystem that is supporting young people from all possible angles, really. And one of the reasons I say that comes from some research that we carried out in a project called Head Start. And that was qualitative data from around 63 young people across England. And they were talking about how they manage the things that challenge their sort of mental health and well-being, basically. And we were able to sort of derive 3 kind of clusters of young people from this. Some who were able to talk about all sorts of sources of support they could draw on. So not just interventions in schools or elsewhere, but actually they had strong family relationships. They felt they could talk to people at school. They had good friendship groups. Actually themselves, they had strategies that they could use to cope. And they could talk about places in the community that they could go or people they could talk to. And they were coping pretty well, actually. And there wasn't a lot of risk that they were having to manage. We had another group of young people who were kind of interesting because they're quite self-contained. So they did talk about family and friends, but they weren't necessarily the major feature for them. They very much talked about coping as being a very individual thing. So they had their own strategies of coping. They did have a bit of risk to manage. They were kind of coping okay, but it did sort of make you wonder, you know, if something major happened in their life, had they really got enough there to sort of help them manage it? And then we had a group of young people who we called uncertain sources of support. And they tended to be those who had a lot of risk in their lives, quite complicated family relationships, you know, felt quite unsafe in their neighborhoods, just felt like they were managing quite a lot of chaos in their lives, potentially. And they didn't really feel like they had any really robust structures to draw on in terms of their wider environment. And they weren't coping fantastically well, which is not really surprising. I think the thought that occurs to me for this is when we're thinking about those sort of interventions that I described earlier, the way those interventions might be experienced by these different young people will be very different, and the amount of impact that those things can have with different levels of sort of chaos and risk and difficulty going on in their lives, we have to just remember that, you know, some of those things might need to be supplemented with other sources of support. So I guess that's just, it seems obvious, but I think sometimes we forget it when we go through the lens of a particular intervention. So building on that a bit more then, I think what I'm saying is definitely interventions in schools have a role, really important to consider that context. But even within the school system, interventions aren't the be all and end all. So there's definitely something about how do we know who needs help? How do we know what the needs are generally for the student population, but also specifically, how do we know which young people really need help? Don't think we've got good models for that. What about the wider school-based system? So that thing that I was saying before, what are these interventions? Where's the broad base? What are the foundations that this is sort of sitting on in terms of wider well-being policy within the school? Is there good leadership and management? I think this is one of the things that definitely is important in terms of sustaining those approaches in schools. Is it being communicated to parents and carers, and how's that relationship within the school? Really importantly, I think this gets missed a lot. What about the student's voice? And I don't just mean the student council, I mean, what about the young people with lived experience of mental health challenges and how they experience the support that's in school? What can we learn from those young people in schools? What about staff capacity? We hear a lot about staff burnout and staff feeling exhausted, staff being incredibly worried about some of the young people they're working with and not feeling equipped to help them. So how do we make sure that they're well supported? And also, you know, how does this plug into the wider system? So what are those other agencies that can be brought to bear in the school system where you know, more sort of specialist help's needed? And also generally, let's not forget the ordinary magic, you know, the sort of warm and supportive relationships, all of those things that those young people with uncertain sources of support I mentioned, you know, are really lacking. And sometimes what they need is those things. So let's not forget that as part of the sort of wider system. And I think I will finish up there. Thank you. And I will stop sharing and pass over to Laura.
Brilliant. Thank you very much, Jess. So Jess spoke kind of very broadly in terms of how we provide mental health support in schools. And what I'm going to do now is narrow down a little bit and focus specifically on one group of young people, so in particular autistic young people. So while this is quite a different talk to Jess's, I think there's also lots of overlaps and lots of areas of convergence. For example, I'll be talking a lot about the wider system, how we identify need, and in particular, how we really amplify student voice and how we listen to and learn from young people. So, as Bonnie mentioned in the introduction, I work at the Centre for Research in Autism and Education, which is housed within UCL's Faculty of Education and Society. And our centre has a really unique ethos in terms of the way that we do our research. So like most autism research centres, we want to do really high quality scientific research. But fundamental to everything that we do is we want that work to have a really positive impact on the lives of autistic children and young people and adults. And we feel that the best way to achieve that is to really meaningfully engage with the autistic community, so autistic people themselves, but also the broader autism community, like those who support them, like schools and teachers, to co-create our research together. And what I'll be talking about today and what I'll focus on is one particular project that we did at Cray, which was co-created and co-produced with a group of autistic young people and was all about autistic young people's mental health. And what I'll do today is give you an overview of that and reflect on what I think some of the important implications for supporting the mental health of this group of young people is, and how we might need to take a slightly different approach when we work with certain groups to support their mental health. And the project itself is a project that was called Know Your Normal. It was a collaboration between Cray and also a charity supporting autistic children and young people called Ambitious About Autism. And one of the things that I really like about this charity is that they've got a very strong commitment to listening to and learning from autistic young people. And they have a strong network of young people between the ages of 16 to 25 who come together and do work to try to make life better for other autistic young people, including those of a school age. And it was this group of young people who received funding from an organisation called My Voice, which enabled them to devote some time and energy to working on a project that would make a difference to their community. And this group came together and unanimously decided that their number one priority, so the one thing that they felt was the biggest issue for autistic young people, was mental health. And they knew they wanted to try and produce a report on this topic, and also some resources to try and support autistic young people's mental health. But they really wanted it to be taken very seriously. And they felt that in order for that to happen, it needed to be underpinned by some really, really good quality research. The problem was, however, that none of them had done research before. So what they did was they reached out to our centre and asked if we'd collaborate with them. And on this slide are some photos of the team who worked together on my project, and it was a really, really big team effort. So there was myself and my colleague Liz Pellicano, who were from Cray and UCL, and there was Georgia Harper, Jack Welsh and Fern Adams from the charity Ambitious About Autism. And the picture on the left is the very first time that we met. And essentially we came together in this room, and as kind of researchers, we said to them, you know, what do you want to achieve? And they kind of explained their goal and what mattered to them, and they spoke about their own experiences. And Liz and I worked with them to help them shape their ideas into answerable research questions. And specifically, what we decided to focus on was the following. So first of all, we were really interested in how autistic young people interpreted normal mental health. So we know that autistic young people experience the world differently in lots of different ways, but we wanted to know, on a day-to-day basis, what's their mental health like, what's normal for them. The second thing we wanted to know was if and how a young person's normal changed if they were experiencing mental health problems. So what might the signs and symptoms of a mental health problem be? How would they know they were experiencing a mental health problem? And how would others around them know that that was the case too? And finally, if young autistic people were experiencing a mental health problem and they were able to identify that, we wanted to know a bit more about their experiences of access and support. And I won't be able to talk through kind of everything that we found today, but I'm hopefully going to give you a little bit of a snapshot of some of our key findings and what we think the implications of those are for schools. So just to briefly mention how we found out the answers to our research questions, we did an online survey that we had a group of over 100 autistic young people complete to try to get a broad overview of some of these issues. And then we did more in-depth interviews with the young people as well. And these young people were largely in mainstream school settings. So it wasn't a full representation of the whole autistic population, but it is a subset of young people whose needs can often get overlooked in school, particularly if they're quite academically able. And that was something that we heard about quite a lot within our research. So what did we find and why is it important? Well, the first thing that we found was that there were quite high rates of mental health problems among our sample. So Jess was talking about how the figures in the general population are around kind of 1 in 8 pre-pandemic, maybe a bit higher during the pandemic. But what we found was that in line with quite a lot of other research studies on autistic people, actually it was about 4 in 5 young people had currently or previously experienced mental health problems, most commonly depression and anxiety. So this group do seem to be quite vulnerable when it comes to mental health. But it's not just kind of diagnosed mental health problems here. So we were also asking our young people kind of what their mental health was like on a day-to-day basis. And the results are pretty negative here too. So our young people were talking about how they tended to feel kind of worthless and under strain and really quite stressed and anxious. And when we were doing our interviews in particular, we were able to identify some of the really kind of unique factors affecting autistic young people that seem to underpin this. For example, there was one young person who I did an online typed interview with, and what they shared was the following. So they said that they feel that the reason that so many people diagnosed with autism develop mental health conditions is because of the way that they're treated. From early childhood, they said autistic kids are excluded, frowned upon, and made to feel unnatural. They're constantly pressured to be more normal, whatever that means. And they go on to say that they think that if somebody who wasn't autistic grew up being excluded, bullied, and pressured to be something that they're not, they'd very likely develop the same conditions. And I think this is really essential in terms of reflecting on the key messages for schools. And I think Jess spoke about this as well when she was talking about the kind of wider ecosystem, because I think it's not just about mental health interventions per se, it's about fostering an accepting and inclusive school culture that really celebrates difference and diversity. And there's likely to have to be a couple of key ways to address this. So first of all, kind of from the young people, and working with those with interventions to help them develop a positive self-identity and a positive sense of what it means to be autistic. And we're starting some work next year to trial an intervention that aims to do just that through kind of peer group support. But also I think it's much broader as well. So for example, there's some brilliant work at the University of Edinburgh at the moment who are running the Learning About Neurodiversity in Schools project, or LEANS. And this is a programme that's all about supporting children, so non-autistic children, just to better understand difference and diversity, and that being different doesn't mean that that's, you know, a negative thing. So I think it's that kind of two-pronged attack that's really important there. But I think as well as initiatives to make the general experience of school better for autistic young people, we've also got to think about the best support for autistic people when they are experiencing mental health problems. But our findings highlighted an issue with this too, in that young autistic people really struggle to know if they were experiencing mental health problems. And Jess touched upon mental health literacy as well, or knowing that you're experiencing a mental health problem. And that can be really hard for young people generally, but it seems to be particularly difficult for autistic young people. So I mentioned earlier that, you know, on a day-to-day basis, our autistic sample felt that, you know, they were just finding life very, very difficult in lots of different ways. And what they mentioned was that when they were experiencing a mental health problem, it wasn't kind of brand new symptoms that were coming up, but just a kind of exacerbation of those existing symptoms. And what this meant was that they found it really difficult to differentiate what a day-to-day difficulty as a result of kind of being autistic in a non-autistic world was, versus a kind of separate co-occurring mental health condition in need of support and intervention. So what our young collaborators did was to work with the Royal College of Psychiatrists to create what they called the Know Your Normal Toolkit. And this was originally a paper resource, but it's now been moved online. And at least the original version, it was this kind of series of cards that represented different areas of a young person's life, such as relationships and self-care and so on. And then on the back of the card were a series of questions. And the idea was that the young person would complete this at a time when they were feeling quite good about themselves, and they'd map out what normal was for them. And that might be different to what other young people, particularly non-autistic young people, might class as normal, but it was what they were happy with. And then if at any time things don't quite feel right, what they can do is complete the toolkit again. And they have something really quite objective where they can say, you know, okay, this is what things were like before, and I was really happy with that. But this is what things are like now, and actually I don't think something's quite right. So it's not diagnostic, it's not something with evaluated yet. But what our young people felt was that it was really helpful in enabling them to understand more about their own mental health and well-being. But it could also be a really helpful advocacy tool in kind of explaining to other people what they were feeling, particularly when this might be slightly different to that of other people. And what I'm going to do now, I'm going to play a short video that our young collaborators created to kind of showcase the message behind the toolkit. Technology works.
At Ambitious About Autism, we're asking what is normal. We want to reclaim the word because we believe everyone's normal is different.
I lay my crisps out in size order, then eat them smallest to biggest. I don't know anyone else who does.
If I've had a bad day, I'll build a pillow fort. Surely that's not normal.
I know it's unusual, but I love Christmas so much that sometimes, just because I want to, I have Christmas lunch with crackers and all the trimmings, even in the middle of summer.
Nobody can really be described as normal. We all have our weird quirks and eccentricities. It's all part of what makes you, you. I'm 18 years old and I'm autistic. Things I do normally are probably different from the things you do. When I'm unwell, my behaviour changes. Seeking help early can make a huge difference to my well-being, which is why it's so important to know what my normal looks and feels like when I'm doing okay. So if that changes and I stop acting like me, I, or someone who cares about me, can explain what is different and seek help. That's why we developed the #KnowYourNormal tool to help young people with autism record and share their normal. You can find the toolkit at knowyournormal.co.uk. Ambitious About Autism challenge you to show us your normal. Share the things that make you you at #KnowYourNormal. At Ambitious About Autism.
Play it again. So I think that video is just a really, really nice way to kind of showcase the message behind the Young People's Campaign, and as well as developing the toolkit and the video, they also wrote a report with what they thought were some of the key recommendations. So not just for schools, but for anyone supporting the mental health of autistic young people. And very briefly before I finish, there was one thing that I wanted to emphasize from the report and the recommendations, and it was about something that the young people felt was really, really important to them in terms of help seeking. And it was summed up by a quote from one young person who said, "What I'd like fundamentally is someone I can trust, someone to talk to, and someone who understands autism, a professional person." And this was really key because, and Jess, I think, mentioned some statistics earlier as well, where I think it was just under half of young people would kind of approach school staff for help about their mental health. And when we spoke to our young people, we found that only around 10% of our sample felt very or extremely comfortable discussing their mental health with those who were supporting them in schools. And it seemed to be because they hadn't really developed those strong, trusting relationships with them where they felt they could really open up. So in terms of areas for development as well, I think this is really important to reflect on in terms of how we enable young people to feel comfortable with the professionals that they spend so much time with, and how we can enable them to feel that, you know, if they approach people around them, that, you know, they can trust them with the information, and that they'll treat kind of what they're saying really, really seriously. So just to finish up, on this slide, I've kind of put some overall conclusions that I think are particularly relevant for schools. And I think the first is just to ensure that schools are really aware of the unique mental health experiences of autistic young people, which may be very different to those of non-autistic young people. I think second, we tend to focus on preventing mental health problems in schools through support specifically focused on well-being. But I think we also need to think more broadly here in terms of more basic factors, such as fostering kind of supportive and inclusive environments where young people feel they belong and feel accepted and feel safe. And it links to Jess's point about kind of bullying interventions as well, being particularly promising in terms of well-being. And I think, you know, this is relevant for autistic young people, but also young people from other minoritized groups, in terms of ensuring they have a really positive school experience, and that, you know, that can help buffer against mental health problems. And finally, I think that in a culture where there are just cuts to supports and services, just a really, really basic thing that school staff can do is really ensure that they get to know their young people and build those trusting relationships so they feel really comfortable approaching them if they need to. So I'll finish up there just to say thank you very much for listening, and a big thank you in particular to my collaborators that I worked with on that project. I think it's over to Jaime now.
Thanks, Laura. Okay, the awkward moment where I just try and share my slides. So let's see if I can manage to do it. Okay, I'm hoping that's working. Can people see that? Brilliant. Laura and Jess, thank you very much. I really enjoyed both of those talks. I'm going to stay talking about schools and mental health and well-being, and then think quite practically about conducting research in schools. So my name is Jaime Smith. I work at the Anna Freud Centre alongside Jessica Deighton, and I lead the schools work. So what does that mean to lead schools work at the Anna Freud Centre? Well, what we're trying to do in my team is to help every school and college to be mentally healthy. So trying to embed good mental health across the whole school community. So thinking about how we're supporting children and young people, also how we're working with teachers and school leaders and parents and carers. There's about 60 people in my team at the Anna Freud Centre, and we're made up of people that have worked in schools, so either clinically, clinicians who've always conducted and done their work in schools, and also ex-teachers, school leaders, SENCOs, people that really understand the English education system and have worked in it clinically or educationally for a while. I have 3 teams in my my department, and we're trying to support schools in 3 different ways. First of all, clinically. So we have a clinical team who are doing direct clinical work in schools and colleges, both remotely, so delivering mild to moderate interventions remotely into schools. We're in about 200 schools across the country doing that, and also doing some face-to-face work in schools across London. So we've got that clinical arm. We also have a training and national programs team. So that's where we're trying to really support school leaders to embed good mental health through training for their whole staff. So we have comprehensive training for all education professionals. So whether that's basic raising awareness of mental health and wellbeing for all staff, including teaching assistants, reception, lunchtime supervisors, anyone working in a school, all the way through to specialist training for SENCOs, for senior leads, for governors, for pastoral leads. And our flagship training is around senior mental health lead training. Most of you will know that the Department of Education have recommended that every school should have a senior mental health lead. We're one of the DFE providers of senior mental health lead training. We trained about 1,300 senior mental health leads last year. So really trying to support those individuals in schools to embed a whole school approach to mental health. So we do quite a lot of work in that area. And as part of our national trainings programs, we also work on lots of research. And Jess talked earlier about the Department for Education for Wellbeing trials that Jess is leading. My team are supporting on that with the delivery arm. So we're doing the training and the delivery for all of those trials. So I'll talk about that a little bit more in a minute. And then the final thing that we're trying to do is to disseminate knowledge. So one of the things that I want to do is get the evidence base into schools. So taking all of the learning that we have, all of the research, all of the knowledge that we have clinically and from academics, and making that very useful and practical, and getting it out into classrooms so that teachers and school leaders can use that work immediately with their children and young people, whether that's in the classroom, through a classroom activity, through a lesson plan, through an assembly, whether it's delivering an inset for their staff, whether it's doing some work with their parents and carers. I want to make resources that are very practical that people can pick up and use. So we disseminate lots of evidence-based resources. We try and do that always for free. That's one of our principles. And we also just try to have a communication channel with teachers. And Bonnie talked at the beginning about the fact that we run the Schools in Mind network at the Anna Freud Centre. So this is a network that's there for anyone working in education who's interested in mental health. And we really want to share our knowledge with them. But we also want to hear back and hear from schools about what their experience is, what's happening for them on the ground, what their concerns are, so that we can respond and react to that. We run the Mentally Healthy Schools website, which is a site that has evidence-based classroom resources from across the mental health sector that we recommend for primary, secondary and FE. And most importantly, we're encouraging all schools to adopt a whole school approach to mental health and to embed that whole school approach. Our whole school approach is called the 5 steps, and it covers staff wellbeing, leadership, curriculum. It covers measurement and evaluation. And as Jess talked about, the importance of pupil voice and thinking about how we work with stakeholders, including parents and carers and the voluntary sector. So we're really trying to embed systemic change across the school system to think about mental health in its entirety. So that's what I'm doing. We've got pretty good reach across the education sector. We've worked really hard to build our reputation by really trying to respond to schools and understand their needs. So our Schools in Mind network members is over 37,000. We communicate with those members once a month through newsletters. We share our information, and we also use that as a channel to recruit to research projects. And we also have really regular seminars and webinars, which are all completely for free, where we invite colleagues from the education sector to come along and hear about themed events. So, for example, this term we did a seminar on emotionally based school avoidance, which is something that schools have told us they're really challenged by at the moment. It's a real problem since the pandemic, experiencing young people that are really unhappy about coming into school. So we ran a free seminar on that with expert speakers, and we had just under 2,000 people attend that. So we have good reach. We trained over 11,000 education staff. We have really good resource downloads, and we're just trying to explore how we might support parents and carers better, really trying to get maybe some psychoeducation out there. So last summer we tested some workshops for parents and carers to see if there'd be an interest, to see if they would want to learn a bit more, and we ran some expert workshops on transition from year 6 to year 7, how to help parents support their young people as they move into secondary, and some workshops around exam stress, which were really well received. We're going to build on that, because what we know is that parents are looking for this psychoeducation. They want to know more about how to support their children and young people. And we want to mirror messages that we're delivering in schools to make sure those messages carry home into the family home, and those conversations continue around mental health. So that kind of gives you a little bit of context of the work that I do and the reach that we have across the education sector. What I was asked to talk about today, and what I'm going to talk about, is the work we do around research. So it's really lovely for me to be able to speak alongside Jess, because I work with Jess every day, and we work really carefully and closely together to think about how we work in terms of schools and research. So I've been working really carefully with Jess on the DFE Education for Wellbeing trial. We're the delivery arm. We've been delivering the training to teachers that are going to be delivering the interventions. And we've also been delivering one of the interventions ourselves. Jess talked about YAM. This is an intervention that comes from Sweden. And we at the Anna Freud Centre have been delivering that, going into schools as part of the trial and delivering that. And we've learned a lot from that delivery. I'm going to talk about that in a minute. But we also do lots of supporting with other colleagues at UCL, and also working at the moment with Cambridge researchers as well. So the way that we do that is we try to support our colleagues in research around school recruitment, so getting schools involved in research, but also we deliver the training as part of different research projects, and we support with interventions in schools. So we really kind of are at the heart of the research work that's taking place. So what I'm going to talk about, and Bonnie, I know I haven't got long, so I'm going to really speed up, but what I'm going to talk about is just some practical things that we've learned, and that I'm sure many of us on the call will know about, but just to sort of share some of the things that we've learned in relation to working in research in schools. Oh gosh, it won't move on now. Why? What have I done wrong? Okay, here we go. So first thing to say is recruiting schools to research is really, really hard. It's really difficult, and that's my overwhelming point that I want to make. I've been working at Anna Freud Centre for about 7 years, and when I first started, it was definitely hard to recruit schools to research, but we did it pretty well. At the moment, in terms of where we are in schools, it feels really more challenging than it ever has. I think schools are under such enormous pressure and face such enormous challenge, and you don't need me to tell you this, I think all of you know already, but schools are still really dealing with the aftermath of the pandemic. Schools are facing enormous amounts of staff absence, staff burnout, dealing with all of the fallout of COVID, dealing with an extremely unstable political environment. We've seen 6 Secretary of States for the Department for Education, like 18 months. We're seeing cost of living crisis. We're seeing schools are having real problems with retention and recruitment of staff. Things are really hard in schools. So schools are unable to take on new things. So even schools that I have known for an incredibly long time and are so committed to research and so committed to mental health and wellbeing, at the moment are saying, do you know what, Jamie, at the moment we can't take on anything else. It's too much for us. We can't take on anything else. So it's tough at the moment out there to get schools to engage in different things. Having said that, we're still doing it, and schools are still really wanting to get involved. So things to consider, I would say, is always make sure that you've got your senior leadership team on board. Every school is going to have to get their head or their governors to sign off on a research. So make sure that when you're pitching research or proposing anything, that you can understand it from the school's perspective. How is this going to support their development plan, their work that they're doing? How is it going to help them with their Ofsted report? How is this going to really work for the school? What difference is it going to make for them? We know that school staff are more willing to engage in research if they really see the benefit for their pupils, for the children in their class, or for the children in their school, or for their teaching practice, or for the wider education sector. So whenever people come to me and say, we really want to try and get schools recruited, I will say, well, okay, well, what does it mean for the school and what does it mean for their kids? I would really encourage you to involve recent school staff in all aspects of planning in your research. They really are a critical friend. At the Anna Freud Centre, I have a panel of current education staff, so teachers and school leaders, and I meet with them once a term, and they just are a critical friend to me. I ask them about what was happening on the ground. Will this work? We're going to try this thing out. What do you think? What do you think of this resource? Do you think this will fly in a classroom at the moment? And they really give such brilliant advice. So all research projects, I encourage you to have an advisory board or a steering group of actual practicing teachers who will really, really help shape your research and make it better. Equally, involving children, young people and parents is also crucial. They're also such an important voice to have from the very beginning. And Laura just talked about all the collaborators that she had. It makes such a difference if you have those people from the start and you see it all the way through, and that young people's voices and parents' voices are included in all aspects of the research. Really important to demonstrate an understanding of the school context and the setting. Every school is different. Every school has its own ecosystem. Every school has its own challenges. And you need to understand what the population of that school is, what's going on for them. Every school will look different to the school that you went to or the school that your children go to. So taking a lot of time to understand the schools you're trying to get into is important. And always budget for incentives. I'm going to talk about incentives a bit more, but it's so important to make sure that there's some budget available to support schools with their research. I don't know why I'm struggling so much each time to move this on. I'm so sorry. There we go. Time. We know that time is, of course, a barrier for all of us, for everything, but it's absolutely a barrier for schools. And I would really encourage everyone to consider the school calendar when planning research. The school calendar is actually surprisingly short. The times, the little pockets of time when you can do stuff are tricky. When you look at the school calendar, of course, we have to think about the school holidays, half terms, Easter, but you also have to discount the first 2 weeks in September when no school will talk to you about anything. The period that we're in now, December, when schools are full of nativities and illness and end of school things. The last bit of summer in July when there's school trips and there's sports days, all of those kind of things. And of course, exam season, you have to think about year 6 SACs, and you have to think about May and June, a bit of July. Secondary schools are not going to talk to you because they've really got all-consuming thoughts around A-levels and GCSEs. So planning research is really important. So the Education for Wellbeing trial that I'm working on with Jess, for example, we're about to go into our delivery period in January, because that's really a good time for schools. January, February, March, we can get a lot done in that term. So thinking about the school calendar is so important. Finding time for space and staff to complete all of the admin that comes along with any school research, and space in schools is so important. If your research needs a classroom, schools don't have spare classrooms, so factoring all of that in is really important. And understanding all of the different external pressures are really key. Despite all of the massive amounts of planning that we put into the trials that we're delivering for Jess, we went into one school ready to deliver our YAM intervention. We were all set up. We were really good. We'd done every bit of planning we could possibly have done. And we got there to deliver to year 9. And we were told, oh, yeah, sorry, year 9 have got their immunisations today. You can't possibly deliver anything. And we're like, all right, brilliant. So we just, things happen all the time when you're just not prepared. You just don't know. That's the school environment. And you just have to work with it. I'm going to be really quick, Bonnie. So in terms of communication, really making sure that you've got lots of contacts at school. Staff turnover is really high. I would encourage you to have at least 2-3 contact names of staff members, because people come and go, they get promoted, they change jobs, they go on maternity leave, they disappear. So always having lots of contacts in the school that you can build relationships with. Making sure that they know everything there is to know about the research you're doing, but also making sure all staff know. I always ask people to have a briefing sheet that you can read out in staff briefing, so everyone knows, so the receptionist knows when you turn up to deliver your training, so that people that know that you're going to be around using their classroom, so that form teachers know. Make sure people understand what's happening and that they all feel part of the research. That will also stop them planning immunisations for that day or disappearing off on swimming galas, which has also happened to me when I've turned up to do some research and everyone's gone swimming instead. Another way of doing good communication is through email. That's probably the most effective way to talk to schools. Sending communication through personalised email is really important. If your research is going to be about collecting data from children and young people, do all of that stuff for schools in advance. Write all of the comms for them. Take all burden away so they don't have to do anything at all. Write the comms for parents and carers. Make sure that you're doing all of that. You're not leading that for the staff member to do. And I would really encourage you to always ask a school to sign a memorandum of understanding. We did that with the research that Jess is leading. We're asking a lot from schools, so we put it down in a memorandum of understanding, saying this is what we're asking of you. Can you kind of sign up and agree that you're going to do that? And this is what we'll do in return. Finally, I wanted to say what all the benefits for schools are. There are loads of advantages for getting involved with research. Access to staff training is so important. For the DFE trials that I'm doing with Jess, we've been able to give lots of training to school staff, which they couldn't afford normally. And they've really enjoyed that, and it helps with their CPD. It makes even more of a difference if you can offer backfill. Every time a school releases a member of staff for training, they have to cover that member of staff. So if we are always thinking about budgeting for backfill and paying for that cover teacher, that makes a difference. Another benefit for schools is the free interventions that they will get as part of research, which they really enjoy and they really benefit from. Free resources. I'm working with colleagues at UCL at the moment on a trial where if the schools take part, they get to keep the resources. So there's some iPads and tablets that the schools will use as part of the research, and they can keep them at the end. This is like gold dust for schools. It's so important. So if you can build some of that into the research, it makes a difference. Payment is amazing. The DFE provide £1,000 for every school that take part in the trial that Jess is leading. That makes a massive difference for schools. It means that they can release admin staff, they can do different things and pay backfill. Benefits also about giving back to student populations. So going back into the school and doing talks to A-level psychology students, helping with UCAS forms, doing some really nice workshops. We're doing some work with colleagues at Cambridge at the moment, and they're researchers around genetics and mental health, and they've gone back into schools and done some really great workshops around genetics and mental health, and doing all kinds of things with children in all year groups to talk about research, talk about women in research, running research workshops around that. All of these things are important for schools. Sharing your research, giving really school-friendly feedback at the end of your research, whatever you've done, maybe doing a different report that works for school leaders that will really tell them more about their population, their pupils, their well-being. And I would say never underestimate the power of a certificate. People love certificates. Everyone likes a certificate, not least schools. And again, in the DFE trial that Jess is doing, every school that takes part gets a certificate signed by the DFE, and they've really liked that, haven't they, Jess? It's made a difference. My final thing is this shout out I want to give to this research paper that actually someone called Anna Moore is the lead author. She's in Jess's team. This research paper is called Shall We Send a Panda? I urge you all to read it just because it's fantastic and really interesting. And it's all about engaging schools in research. And it's a lot of learning that we've had from Jess's team and the trials that we've done. And, you know, I don't want to give too much away because I want you to read it. But essentially, if you send a beautiful picture of a fluffy panda in an email, schools will reply. And there's a picture of that panda there waving, and it made such a difference for us that we couldn't get a school to reply to anything, and then we sent a picture of a panda and they couldn't reply quick enough. There's a lot of learning in the paper that's much more advanced than that, but I urge you to read it and take a look because it's brilliant. Bonnie, I went way over time. I really apologise. That's it from me.
Thanks very much, Jaime, and thank you to all of our speakers. I feel completely overwhelmed by questions and interest in things that are going to inform my research. And I love the idea of sending a panda. I'm always the person to send a silly thing, and I'm always like, is that a good idea or is that a bad idea? So now I know that I can keep going with silly things. That's great to know. I have questions, but I don't want to dominate. So do raise your hands if you have questions or put them in the chat. I do have a couple of questions that I'll go straight to. Before I do that, I do just want to say that the thing that really struck me about the three speakers was there were so many links between all of your work, even though it's all very different. So I was very struck by thinking about the children not in school. It's something I'm very passionate about, so I was glad that that came up. Thinking about mental health literacy, thinking about, I love the Know Your Normal, Laura, and it just made me think we should be doing Know Your Normal for everybody, because one of the things that concerns me most about whole school approaches and so on is we need to think about the negatives to increasing knowledge and understanding and acceptance and destigmatization and all of those things that are so super important. We need to understand really well what that means. And the idea of Know Your Normal for every child is just, I loved it. So thank you so much to all of our speakers. Niran, I know, has had to leave, and she had a question for Laura, and we can answer it, Niran, and hopefully you can look at this recording. Which measures did you use for assessing mental health problems in your survey for people with autism, Laura?
Yeah, that's a really, really good question, because actually this is notoriously difficult. So in a lot of mental health research, there are some kind of standardized questionnaires that can be used to assess mental health. But actually there's a body of research that's been developing, particularly in the autism field, that suggests that they may not be entirely applicable for the autistic population. So some measures of mental health ask about things like sleep or kind of day-to-day struggles. And what many of our autistic young people say to us is, well, actually, I do have problems with sleep, but it's not linked to a mental health problem. It's because I'm autistic and my sleep's all over the place generally. There's also been a body of literature showing that actually some of the ways that the questions are phrased and the response options can be really difficult for autistic people as well. And actually a body of work that we've been doing on loneliness and autism recently has been giving people standardized measures of loneliness and getting people to comment on the questions and where they're having difficulties and things. And there are a lot of difficulties with some of these questions, and people are just saying, you know, I can give you the answers, but it's not going to give you a good representation of what being autistic or kind of being lonely means as an autistic person. So we work very closely with our young collaborators. We decided to ask people directly if they'd had a kind of diagnosed mental health problem, or if they thought that they had a mental health problem as well, and what that was. And we also adapted, we found a kind of general health questionnaire that our young people quite liked. We made some very slight adaptations to it, and it was very, very short. And we used that as well for assessing mental health. So it was a combination of a kind of adapted standardized questionnaire, as well as directly asking people about diagnosed mental health conditions too. And what was encouraging was we did get very similar findings to previous work as well.
Great, thanks very much. I think also linked to that from Claire Roberts, who asked whether you found any of the young people in your study, Laura, had alexithymia.
Yeah, so for anyone who's not familiar with alexithymia, it's a difficulty understanding your own emotions, and that potentially also links to difficulties with knowing your normal and mental health literacy. We didn't look at it specifically within our sample, but there has been a systematic review a few years ago led by researchers at King's, and what that showed was that while alexithymia is prevalent in about 5% of the general population, it's about 50% of the autistic population. So I'd be quite confident that quite a few of our sample would have had alexithymia, and that might be underpinning why kind of helping them understand their normal might be particularly helpful.
Thank you. Just super interesting. Thank you. There's a question on the chat. How do schools get involved in research? I'm a school leader in a school for... You're going to get people chomping at the bit, I think. I'm a school leader in a school for students with SLCN and ASD, and I think this would be really interesting, useful route for us to better support mental health of our students, especially those who are missing out on CAMS. Do either of you want to, any of you want to respond?
I can chip it.
Do you want to go ahead, Jess? Yeah.
Is to join the Schools in Mind network that Jaime mentioned, because that's often the conduit. If we've got any research to advertise that the centre's involved in particularly, we will advertise through those networks. So that's a good place to know about research, and indeed, in fact, other opportunities. But Laura may have more specific ones that answer that particular area of interest.
Yeah, I think there might be kind of local networks to look out for as well. So just in the autism field, for example, one of the networks I run is called the Pan London Autism Schools Network Research Group. This isn't an open network, unfortunately. So it's a network of kind of solely autism specific special schools in London and the surrounding area. But it's a group who, interestingly, didn't used to take part in a lot of research, but not because they weren't interested or keen, but actually because their young people in their settings often didn't meet the inclusion criteria for lots of studies. So what they did was they took it upon themselves to approach a kind of research centre and say, you know, we want to be involved in research, but actually we don't really have an avenue through which to do that. And what we do now is we come together, a team of academic researchers and leads from the school, and we've got about 15 to 17 schools in our network, and it's kind of model of knowledge exchange, which works really, really nicely. So the academic researchers talk about some of the latest developments in the field, and the schools talk about their priorities, and some of the kind of Jess spoke about the kind of, you know, schools often hear about what other schools are doing, find them really interesting and implement them. So they talk to us about that. And the idea is that hopefully we can come together and start to form that evidence base and really, you know, do high quality evaluations of some of the practices that they're doing. And like Jaime was mentioning, you know, co-designing them together, thinking about what's feasible in the school setting, what would benefit them. And I think it's that collaboration that's really important. So it might be approaching, you know, researchers as well in local universities who've got an interest in this area, who might be keen to collaborate.
Thanks very much, Laura. That's great. I want to squeeze in one more question, if I may. There are some comments in the chat, but I want to turn to Andrew McWilliams, who says, I'm a child and adolescent psychiatrist, interested to hear views about awareness of ASD. And you said you'd like to go on camera, so go ahead, Andrew. This will probably be our last question because we finish at 15:15. Thank you, everybody.
I'll try and be quick, and I hope you don't mind me hijacking the camera, but I thought it just might be easier for me to explain, because maybe it's a bit, you know, a bit controversial to talk about, because it's so important, all our stuff on mental awareness, awareness of mental illness and awareness of neurodivergence and autism. And I've just had this thought in my own practice from seeing children and adolescents that for some people, actually, maybe this awareness has promoted a sense, instead of mental illness and ASD being stigmatized, I think there are some schools where it's become a bit fashionable, actually, to have autism for certain maybe subgroups of teenagers. And I just think it's really interesting how you maybe tread these kind of discussions that happen, because I just see for some of the teenagers that we work with, there's maybe an interesting thing going on as they become more awareness about difference, if you like.
I'd be very interested to hear people's views. It's something I feel very passionate about. Yeah.
I'm happy to kind of try and start. I think it's a really difficult one, and I think we've got to be really, really cautious as well. You know, we see a lot of kind of late diagnosed autistic people who have kind of gone through life not knowing why they're different and why they haven't kind of fitted in. And often it's kind of a process of internalizing lots and lots of negative experiences. And then suddenly, you know, they become aware of autism in some way. And it really does answer a lot of their difficult, you know, it answers a lot of questions. It kind of helps them make sense of everything that's kind of come before. And it's really a light bulb moment where they can begin that process of not internalizing challenges, but really start to think kind of more positively about those differences. And I think that's a really, really positive thing as well. And we've done a lot of work with kind of autistic peer support groups as well, where it's been that sharing of challenges, and it's been really, really beneficial from a kind of therapeutic perspective as well. You know, the diagnostic criteria for autism is broadened out as well. You know, years ago it was a very, very narrow group, and we are seeing this, you know, much more broader understanding. Obviously it's difficult, you know, we don't know where the borderlines are, but I also do think, you know, there is a benefit if a label, you know, seems to fit and it seems to answer questions. And I think this is something our young people were talking about a lot, actually, you know, feeling quite worried to bring these things up at sometimes in case they felt that, you know, people wouldn't kind of believe them in a way. It's a really, really tricky area. I think, you know, we've got to, I don't know what the answer is, but I think it's really, really important to be quite careful in this sphere. I'd be keen to know what other people think as well.
Thank you. I'm very aware of time. We should let people go on time. This is a conversation that I feel like, could we just book a moment in the diary to have this conversation at some time? Let me thank all of our speakers, all three of you. Thank you so much. A very, very thought-provoking and interesting seminar today. And let me wish you all a very happy holiday when it comes. I hope you all take a good break, and thank you all. That was great. Thanks ever so much.